Well, a major hospital in Melbourne could be forced into shutdown with 8 staff members testing positive to coronavirus as the outbreak forces students back into remote learning. Dr Vyom Sharma is a GP practicing in Melbourne and he joins us now. Doctor, good morning to you. Thank you for your time this morning. Do you feel healthcare workers are being adequately protected at the moment?
The protection has come, but it's come quite late, frankly. We've had rising community transmission since the end of June, and yet masks were only made mandatory last week. The advice is trickling in very slowly, being implemented very slowly. And as a result, what we've got is not just this one outbreak at this hospital that's getting a lot of attention, but 7 different hospitals across Melbourne with hundreds of staff in quarantine. So support doesn't just mean it's not just about looking at the numbers of infected staff going, oh, look, there's not that many who've got COVID-19. It's also about the number of people who are exposed. And when we've got staff being exposed in the hundreds, you know there's more we can do.
How does it happen? I mean, how do medical professionals go to work with any confidence that they aren't going to get it?
It's been a battle right from the start, right from March. We have been behind in the race to get adequate personal protective equipment. And often the system has been working against staff. They're being actively discouraged from wearing masks lest it scare patients. So it's really not good enough. I think we've finally gotten on board. Really, the government should have given a much more support through guidelines, encouraging things like cloth masks for patients and visitors to make it a sustainable thing that everyone around the hospital environment can wear masks. So I think it's happening, but it's been a battle and not a very encouraging one.
Look, I took a flight over the weekend, luckily enough on Friday, from New South Wales to Queensland. A lot of people had masks on, but the staff on Jetstar didn't have masks on. So there are rules or there are no rules. People are making up their own mind. I don't understand. It either works or it doesn't, or if it does, or if there's a chance that it does, then make it mandatory.
There are still many inconsistencies, and a lot of it just comes down to confusing messaging. So the government does say on both levels, federal and state, that you should be wearing masks if you can't socially distance, if there is wider community transmission. This is the situation that Melbourne is finding itself in. And yet we're still getting terrible bits of messaging. For example, there are kids going back to school today, and yet masks are not recommended for those under 18, even in Victoria and Melbourne. And you've got the Health Minister, Greg Hunt, promoting infographics from the federal government with the big question at the start saying, do you need to wear a mask? And the first word answer is no, and then a bunch of exceptions. The messaging needs to be sorted out. It's true, masks are a complicated thing to convey. They do have some trade-offs, but they are likely to confer some kind of benefit. We just need far better communication from the government.
If we've got them, let's make them mandatory. I mean, you want everything in your arsenal, don't you?